Hello, everyone. Good evening to one and all. First of all, a very warm welcome to all of you on my talk show. We are going to wait for a few minutes for few people to join and then we will start. The background voice, I think we will have to lower a bit. Right? Now it's great. So, congratulations to all of you who have joined here because you know what? You all are in among 10% of the people who come to on any health show. So pat yourself first that you are not in the 90% range who always have a reason for not being here. It shows that you are really conscious about your health and want to become a better version of yourselves. You see, only the 10% of people in our society ever come to any health show like this. And the other 90% always have a reason for not being there. So, how many of you know such people who could have been here but had an excuse for not joining us? Anyways, let me introduce myself. I am your host, Shweta Brahmbhatt, founder of Shivatva. I have worked in healthcare for more than 12 years, and I really love hosting such events and bring people to talk about topics related to health and wellness. We want to make this a really active conversation. So we have a chat that is open for everybody. And we'll answer the questions in the end. So please don't hesitate to ask the questions that you have in your mind. Hormonal imbalance is a very common problem faced by many of these nowadays. And statistics show that more than 80% of the women are suffering from hormonal imbalance. And many of them are living without even knowing about it. Experts say that most people will experience hormonal imbalance at least once or twice in their lifetime. And therefore, the topic like this is the need of the hour. I myself was going through hormonal imbalance at one point in my life. And therefore, I have decided to take up this topic to help people who are struggling with this issue. Now, hormones affect the quality of life of both men and women, as it plays a huge role in normal functioning. Your heart rate, sleep cycles, reproduction, metabolism, growth, development, mood, stress, body temperature, and all are affected by hormones. So basically, hormones are messengers that regulate majority of our body's physical and mental functions. And therefore, balancing the hormones is crucial for our overall well being. Now, to understand the crucial role of hormones for our overall wellness, We have with us today Dr. Sandeep Agarwal, who is one of the well known endocrinologists in Ahmedabad. He is an owner and founder of Arya Endocrine Diabetes and Hematology Center on Science City Road in Ahmedabad, and is also working as a consultant endocrinologist at APIC Super Specialty Hospital. He has also worked as a faculty in the Department of Endocrinology at CMC Vellore. He has more than 20 years of experience in medical field and 10 plus years of experience in treating hormonal conditions. So guys, without wasting a minute, I would like to get started as it is a very rare opportunity that we get to hear from such a learned man in his field. So, a very warm welcome on my show, Dr. Sandeep Agarwal.
Thank you so much, Sweta ma'am, for inviting me for this topic, balance your hormone imbalances. So, as you said, that this is a very important and relevant topic of today, because many people do not know that they are suffering from hormonal imbalance, and they keep suffering till one day, one fine day, some endocrinologists make a diagnosis that yes, you are suffering from hypogonadism or thyroid disorder or some kind of ovarian dysfunction. So then only they know that they are having some hormonal disturbance. Otherwise they will keep on eating some kind of vitamin tablets or some calcium tablets and whatnot. So hormonal disturbance is very common in general public, and in our busy lifestyle we have lack of sleep, and environmental pollution is sky high, and also we have continuous use of plastic material that also releases some kind of chemicals like polyethylene, and a lot of endocrine disrupting chemicals which disrupts the our endogenous hormonal balance. So there is disruption of hormonal balance, and that leads to endocrine disturbance, and that causes this kind of various hormonal imbalance.
Okay. So, how does it affect our day to day life? Like, in which way we used to suffer? Like, many times we do not even know that we are going through hormonal imbalance. How does it affect in our, like, what are the early signs?
Hormonal imbalance can affect in many ways. Like, let's say if somebody is having some thyroid disorders, so thyroid disorders again can be hypothyroidism, hyperthyroidism. Suppose somebody is having hypothyroidism, let's say. So hypothyroidism can have very variety of symptoms. Like, if we, it depends upon the age group in which the affection has happened. So if the child is suffering from hypothyroidism, they will have retarded growth, they will have learning difficulties, and their intellectual ability will be low, and sometimes can have pain abdomen. So all these things can be there. Pain abdomen could be due to enlargement of ovaries, and sometimes they can have premature precocious puberty, so they will have early puberty or delayed puberty. So this is in childhood. In adolescent age group they can have behavioral abnormalities, so and they can develop obesity. In adult males or females, there can be varied symptoms like obesity, and they can have disturbed cycle. Sometimes they do not get menarche, so that can
Hmm.
also be a symptom. And cold intolerance could be there, तो गर्मी में भी ठंडा लगता है, तो ये भी एक possibility हो सकती है. So this was a brief about hypothyroidism. And when we talk about hyperthyroidism also affects us in many ways. So again, age group is different. So in children, there can be learning abnormalities, and they can have hyperkinetic disorders. So दे कैन हैव अटेंशन डेफिशिट. कुछ बच्चे ऐसे होते हैं कि जो क्लास में भागते दौड़ते रहते हैं, तो दे कैन हैव अटेंशन डेफिशिट हाइपरकाइनेटिक डिसऑर्डर्स. And in middle age they can have infertility problems, and there can be eye problem. So eyesight may be affected because bulging of eyes can be there. Also in adults there can be multiple problems, like sudden weight loss can be there. They can develop heat intolerance. So, and tremor, proximal muscle weakness, तो they'll find it difficult to stand up from the squatting posture. So बहुत सारे symptoms हो सकते हैं patients के in adults about hypo and hyperthyroidism. Again, we can have another hormonal imbalance like problem in pituitary, a problem in adrenals. So that can affect in various ways, like hypogonadism can be there, and uh, and uh, and there can be some calcium disorders, phosphorus disorders because of parathyroid hormones. So, lot to discuss on this topic, and I think 1 hour may not be sufficient to explain all these things.
Okay, I totally understand. Like many times, we notice that in thyroid conditions, most of the time, like men and women are not even knowing that they are going through thyroid disturbance in their life. Like, and nowadays it is very common. Mostly, like, 1 in 10 adults are suffering from thyroid disorder. Why is it so common in females? Like most of the time, she is having thyroid problem, but she is not knowing till it has gone, the TSH value has gone very very low. So what is the reason behind that?
Women definitely have more of autoimmune problems and thyroid disorders, maybe hyperthyroid or hypothyroid. That is more common in females, and the exact reason is not known. But people have given multifactorial etiology, and one of the etiology is genetic factor. So they have we males have one X chromosome. So we have XY. Our genetic is 46XY, and the females have 46 XX, so two X chromosomes are there, and the chances of mutation in these, because this contains X chromosome is larger and contains more genes, so the chances of genetic mutation is much more compared to males having a single X chromosome. So the reason being this, so that leads to more of autoimmune illness in females, and other genetic factors are there, and role of estrogen has also been postulated. So exact cause is still not known, but this could be the possible reason, double X chromosome.
Okay. So another thing is, which is very alarming nowadays, is diabetes. Globally, more than 463 million people are suffering from diabetes. And out of that, 77 million people belong to India. Why is it so prevalent nowadays? And which hormonal imbalance is responsible for diabetes?
Diabetes is a very hot topic of today, and I love seeing diabetes patient and treating them. It gives lot of personal satisfaction when I treat diabetes. So the you have asked a very pertinent question that why diabetes is more common. So previously we had less facilities, so we had lack of transport, and vehicles number were also less. So very few elite class people were only having vehicles. So nowadays we everyone is having two cars or bikes, or public transport is also available. So what happens is our lifestyle has been restricted and we hardly move, so we have a tendency to develop obesity. So Indians are more obese, and obesity is more in the tummy. So that is called central obesity. So central obesity leads to more of insulin resistance, and more of insulin resistance leads to diabetes. So that is one factor. So one is lack of active lifestyle. Second is environmental pollution. Third is genetic factor. So if father is having diabetes, the risk of child having diabetes is more, type 2 diabetes. And if both parents are having diabetes, let's say mother and father both having diabetes, the risk rises more than 80 to 90%, or I will say 100% is the risk if the child does not take care in terms of changing his lifestyle and diet. So that is another factor, and other factors which can contribute to the development of diabetes is hypertension and dyslipidemia. Dyslipidemia is lipid abnormalities, so patients will have high cholesterol, high triglyceride, high LDL particles. So this also increases the risk of diabetes. Other than that, PCOD could be contributing to the development of diabetes, and lot more, like increased waist circumference, increased neck circumference. So this admi ka neck circumference, in male and female, the cutoffs are different. So if the neck circumference is less, let's say more than 14 inches, the risk of developing diabetes is more. And increased wrist circumference. So wrist circumference is also a parameter nowadays. So all these factors are contributing to the development of diabetes. Also environmental pollution, as I said earlier also, that use of plastic bottles, which releases a lot of endocrine disrupting chemicals, so that could be the reason for development of diabetes. So list is endless, but these are the few factors which can promote the development of type 2 diabetes. And type 1 diabetes, the risk is basically autoimmune. There is autoimmune destruction of the pancreatic beta cells that leads to the development of type 1 diabetes.
ओके, वो कहता है ना कि डायबिटीज इज लाइक अ राज रोग, जो एक बार हो जाए तो फिर जाता नहीं, एंड देन स्लोली स्लोली इट इन्वॉल्व्स ऑल द अदर सिस्टम्स ऑफ आवर बॉडी. So what are all
Agreed.
precautions like should person take if he or she is a diabetic?
Precaution is basically there are three treatment available for diabetes. One is choosing a healthy lifestyle, so a person can go for a daily walk. So I ask all my patients that yes, you should go for a 30 minutes walk a day. And if you want to prevent diabetes, or if you want reversal of diabetes, you can go for, let's say, 1 to 2 hours walk a day. And it is very easy to reverse diabetes, especially in obese patients. So that is one thing. And if the वो कई लोग कहते हैं टाइम नहीं मिलता है सर, तो टाइम नहीं मिलता है, ठीक है, तो you can walk at least for 5 minutes in the morning, 5 minutes in the evening, and 5 minutes in the office. तो 15 मिनट मिल सकता है, then you can walk 15 minutes at least. That is one way of helping your diabetes. Second is choosing your diet. So diet may people have a lot of misconception that what diet they should take. So regarding diet, many will eat five chapatis or maybe a bowl of rice and other things. I ask them to eat the seasonal fruits and vegetables first, then curd or charge later, and finally they should eat roti or chapatis and vegetables. And of course, protein should be taken at least 1 to 2 cups. 1 cup is around 150 ml, so 1 to 2 cups of protein. Any protein is good. Let's say dal or paneer or soya bean rajma. Anything is good. If the patient is non-vegetarian, they can take boiled egg or chicken or mutton, whatever they prefer.
Okay.
So diet, exercise, and finally comes the role of drug. Drug is not the first therapy. So last is the drug therapy, which should be taken by the patients. So drug therapy is just only for assistance. That किसी का diabetes control नहीं हो रहा है, यदि after in spite of lifestyle modification and diet, then they can go for drug therapy. So drugs will definitely control their sugar, and we should target their sugar in almost normal range, especially for younger patients. And for older patients, we can target little relaxed targets.
Okay. Like many people are saying that even now yoga and meditation also help people to reverse and downsize this thing. So do you think is it helpful in endocrine curbing endocrine disorders?
Yes, yes, yes. Yoga is very relaxing, and definitely once if one does yoga in a proper way and in regular basis, so definitely that will help in decreasing the sugar levels and in controlling the disease. Of course, yoga also helps uh, in uh, in controlling the mind, and it increases the flexibility of the muscles. So yoga, there are certain studies also in which it has been seen that yoga definitely helps in controlling diabetes. So definitely, if somebody can do yoga, yoga is very difficult to do because you have to attain certain postures and all. So simple yoga is okay, but definitely when you do yoga in a proper way, so it is taxing on the body. But definitely, if someone does it in a proper way and does daily, it will definitely help in diabetes and other endocrine uh, uh, organs also.
Okay. Another alarming condition, like which is very common, is PCOS, irregularity in periods, infertility, abnormal hair growth in teenagers and young, and perimenopausal women. All. So, what is the connection between obesity, irregularities, PCOS, infertility? What
PCOD.
people, what we can do for that?
The PCOD is a very common condition, and almost 10 to 25% of the young females are developing PCOD. And PCOD could be lean PCOD, could be obese PCOD. So, obese PCOD is more common, and lean PCOS is less common. So, PCOD is basically what is it is polycystic ovarian disease. So, polycystic ovarian disease develops because of abnormal endocrine function. So there is abnormality of the luteinizing hormones from the pituitary. So there is preferential secretion of luteinizing hormones from the pituitary, and luteinizing hormone leads to more secretion of androgens. So more androgen secretion is there from the ovary and from the adrenal glands. So this leads to increase in the hair growth over the face, chest, back, thighs, and also there is abnormal ovulation. So there is ovulatory dysfunction, which leads to infertility. And of course there is increase in the acne eruption. There is increase in the acne eruption, and patient develop obesity also. So all these features are there. So once they develop irregular cycles, there could be decreased bleeding, and infertility is very common. And if even if the patient conceives, there is the chances of miscarriage is more. Apart from acne and hirsutism is abnormal facial and facial hair growth. So apart from acne, hirsutism, obesity, and irregular menstrual cycles, there could be dyslipidemia, hypertension. All these complex problems can occur, and almost 40 to 60% of the PCOS females are having obesity. So it is a complex problem, like obesity, PCOS, diabetes is also common in patients with PCOS because they have increase in the insulin resistance. So insulin resistance leads to development of glucose intolerance, and later development of diabetes if the patient is not doing proper exercise and all. So the situation is complex, and there are a lot of studies which have given contradictory results also. So ideally we should avoid obesity, and we should try to maintain a healthy lifestyle.
Like there are certain conditions in which weight management or periods are not a problem, but many times it is associated with allergies. So what is can person do for that?
No allergies.
Yes, like there are certain conditions. Like I have got one question also, uh, that periods and weight management is not a problem, but they are facing certain kind of other issues and allergies as well.
Allergies can be there if the patient is having, let's say, Addison's disease. So, Addison disease is a condition in which the cortisol deficiency is there. So, cortisol excess leads to decrease in the eosinophil count. So, when there is decrease in the cortisol levels, there is increase in the eosinophil levels. So, hypereosinophilia can lead to increase in the itching and all. Otherwise, at such other condition which can lead to increase itching is hypothyroidism. So in hypothyroidism, there is dryness of skin, which can lead to increase in the irritation and itching. So these are the two conditions which I know could lead to itching. Otherwise, endocrine condition as such does not lead to itching.
Okay. Like too often we also hear that stress is the root cause of all the diseases, but how much is it true for hormonal imbalance? What is like connection between stress and hormones?
Stress is very common nowadays, so as we all know that. And stress because of our lifestyle. So I don't think there is a stress in the environment, but we tend to take stress. We want to lead fast lifestyle because of the corona has taught us that okay, आज जी लो, कल किसने देखा है. तो
Yes.
इस एक गाना भी था कि कल हो ना हो, तो वो चीज़ है. तो आजकल क्या करते हैं लोग कि ठीक है, आज खा लो पी लो, मूवी देख लो. तो उससे प्रॉब्लम क्या होती है कि देयर इज बिकॉज ऑफ स्ट्रेस दे डोंट स्लीप वेल,
Mm-hmm.
and they sleep hardly for 4 to 6 hours. So
Okay.
what happened? There is increase in the cortisol secretion from the adrenal gland. So there is first there is increased secretion of ACTH from the pituitary. तो उसकी वजह से there is increased secretion of cortisol from the adrenal gland, and what it leads to is increase in glucose intolerance. तो ग्लूकोज इंटॉलरेंस हो जाता है और लोग मोटे हो जाते हैं, क्योंकि कॉर्टिसोल एक ऐसा हार्मोन है जिसकी वजह से भूख ज़्यादा लगती है, और भूख ज़्यादा
Okay.
लगती है तो लोग मोटे हो जाते हैं. एंड उसकी वजह से उन्हें नींद भी कम आती है. जब व्हेन देयर इज हाइपर कॉर्टिसोलीमिया, तो उसे नींद भी कम आती है. तो नींद कम आ रही है जिसकी वजह से स्ट्रेस बढ़ रहा है, स्ट्रेस बढ़ने की वजह से ग्लूकोज इंटॉलरेंस हो रहा है, और नींद कम आ रही है. तो इट इज़ अ विशियस साइकिल. तो उससे
Hmm.
बाकी हार्मोन्स भी इफेक्ट होते हैं. तो हाइपर कॉर्टिसोलेमिया की वजह से थायराइड भी कम हो जाता है. तो इट्स अ विशियस साइकिल. तो इसकी वजह से सारा सिस्टम इफेक्ट होता है. इससे आपका टेस्टोस्टेरोन भी इफेक्ट होता है, ईस्ट्रोजन भी इफेक्ट होता है. तो ये सब हार्मोनल इम्बैलेंस कर देते हैं. तो आई विल टेल पीपल दैट उन्हें सोना चाहिए 7 से 8 घंटे. और अपने जो 10 बजे के बाद जो अपना आपका फेसबुक चैट है, व्हाट्सएप चैट है, दैट शुड बी स्टॉप. Sleep for 6 to 8 hours, work, exercise for 1 hour a day, and rest. 14 hours is yours.
Yes. True, true, true. Very nice. Very well said, doctor. So, how we can, connect, or if we want to summarize what and all precautions we should take for each and every hormonal imbalance, then,
Yeah. So one is sleep well, at least 7 to 8 hours a day. That is one. Dusra, walking 30 to 60 minutes a day. Third is yearly monitoring of your TSH, HbA1c. TSH से पता लगेगा कि आपको थायराइड हुआ है कि नहीं हुआ है.
Mhm,
HbA1c से पता लगेगा कि आपको ग्लूकोज इंटॉलरेंस हुआ है कि नहीं हुआ है, या प्री डायबिटीज या डायबिटीज है कि नहीं है.
mhm,
और बाकी एक रूटीन, अगर कोई मोटा है तो उसे लिपिड प्रोफाइल कराना चाहिए, क्रिएटिन कराना चाहिए, और सीबीसी, रूटीन यूरिन, ये साल या 2 साल में एक बार करा सकते हैं. And fasting glucose should be done maybe yearly. If the family history of diabetes is there, they can do it more frequently if they are obese. Other than that, if the patient is suffering from many symptoms of hormonal imbalance in terms of obesity, or sudden weight loss or sudden weight gain and proximal muscle weakness, तो उनको एक डॉक्टर से मिलना चाहिए, preferably a endocrinologist who can guide them in a proper direction.
okay, great, great. Like I had been through myself, with thyroid or hormonal balance and PCOD in my life at one point. So at that time, like कई टाइम तक तो ऐसा था कि मुझे पता ही नहीं था कि आई एम सफरिंग फ्रॉम थायराइड इम्बैलेंस. तब जाके थोड़े बहुत सिम्टम्स जब दिखने शुरू हुए तब पता चला कि ओके आई एम आल्सो गोइंग थ्रू थायराइड हार्मोनल इम्बैलेंस. एंड तब तक जब चेक कराया तब तक तो टीएसएच इतना लो हो चुका था कि इट वाज लाइक एन अलार्मिंग कि पता ही नहीं है कि अब क्या करना है. कई बार ऐसा होता है, तो उस केस पे क्या करना चाहिए?
TSH was low for you.
या.
ओके. तो उसमें सिम्टम्स जो है, कई बार मैंने बताया कि टीएसएच अगर लो है तो दिस इंडिकेट्स दैट योर थायराइड फंक्शन इज हाई. सो उसमें वेट लॉस हो सकता है, और घबराहट, बेचैनी, नींद की कमी हो सकती है, एंड हाथ पाँव में कंपन हो सकता है. सो ऑल दीज थिंग्स कुड बी देयर. एंड सो इस कंडीशन में थायराइड हार्मोन का टेस्ट करना चाहिए. लाइक TSH वाज डन, तो T3 T4 शुड हैव बीन डन. एंड एक एंडोक्राइनोलॉजिस्ट की सलाह जरूर लें, बिकॉज सेल्फ डायग्नोसिस एंड ट्रीटमेंट इज वेरी डिफिकल्ट. वी हैव लर्नड इट over a
एग्जैक्टली.
period of 15 to 20 years after MBBS. तो 15 से 20 साल हमें लग गए. So it's not so easy to make a diagnosis and treat patients unless and until you have a vast experience. तो मुझे लगता है कि इसमें एक डॉक्टर की सलाह ज़रूर लेनी चाहिए और साल में एक बार चेकअप, साल डेढ़ साल में एक रूटीन चेकअप के लिए ज़रूर जाना चाहिए.
एग्जैक्टली exactly. अभी तो आजकल तो ऐसा हो गया है कि सभी गूगल डॉक्टर बन गए हैं. So,
Yes, yes. After, especially after Corona, after Corona,
yes,
people will okay, छोटा मोटा इलाज तो they can do it on their own.
on
But
their
but
own,
I
yes.
think but I think that yes, they can come to they can go to endocrinologist and take a routine consultation. Maybe yearly is good enough. और अगर ठीक है, अगर उनको लगता है कि ज़्यादा उनका बजट नहीं है तो टू ईयरली में 2 years में एक बार जाके मिल सकते हैं.
Well, nothing is more expensive than your own health. I would
Exactly,
like to
exactly.
say as a disclaimer that the content we are providing on this show is for generic information. It's no way substitute of qualified medical opinion. So you should always consult a doctor in case if you are having any issue with your health. So it's and actually these all conditions vary from person to person. So do not go with just one opinion all the time. You should definitely go and consult specialist or super specialist. Yes. So now, as we are approaching towards the end of the show, we would like to take some questions over here. Yes. Let me see the questions we have received. Yeah, one question I have received is like, what to do for colon strengthening after any surgery? Like, I do not know how much relevant is this question, but we have received this question like, what we can do for colon strengthening after any surgery.
No, what surgery was done that that will answer the question. So what
Uh,
surgery was done? So colon strengthening. So colon is a very good organ in our body, and definitely 50 to 80% of the patients, people in India are suffering from constipation. So what we can do is we can do colon cleansing. So colon cleansing can be done by taking high fiber diet, more of fruits, vegetable, chia seeds, flax seeds. All these things can be taken, and those patients who are suffering from constipation, chronic constipation, they can take isabogol powder. It is easily available in the market, and of course, plenty of water and exercise. And other thing is that they should do routine TSH. That is easily available at a cost of let's say 200 rupees or so. So that this is the way we can do colon strengthening. So other than that, I we can discuss in details with that uh, person if at all more details is needed.
okay. Yeah. Like, can we describe one, specific chart which each and everyone can follow in their daily routine, like specific health, diet chart, if that will be
Yeah,
good
yeah.
for our
So
audience.
yeah, so for diet, I say to my patients, I basically basically American Diabetes Association says that we should customize diet chart for each patient. So
Hmm.
these days I don't give diet chart to anyone. I customize them for each of my patients. Different patients have different requirement. So somebody, let's say, if the patient is eating khakra, so they will not change for me that okay, no, from tomorrow I'll eat upma or poha. No, they won't do. So the
Uh-huh.
for past 20 years they have been eating khakra or fafda, so they will eat khakra only. So we have to
Yes.
customize we have to customize the diet chart for each and every patient. So if you ask me in general, so I'll say that they can have 300 ml of milk and one chapati or two chapati, depending upon the BMI, body mass index. So that is
Mhm.
for the morning, and mid morning they can have some fruits or they can take tea and biscuit. And lunchtime they can take two chapatis, a ball of dal or rajma, chana, along with 300 grams of fruits and raw vegetables. And And curd also, they can include curd. And in Gujarat, they consume chas, so the chas and curd are both equally good. And in evening time, they can take a little bit of chana. So roasted chana is okay. And if they don't want to take chana, they can take one khakra or a small katori of
Time they
mamra.
can take a little bit of
And dinner time, they can take one katori khichdi. One
and
katori is 150 ml khichdi. So 150 ml khichdi, or khichdi curry with fruits, vegetables, and little curd, and bedtime milk. So this is the simplest diet chart which I share to all my patients. And other than that, I customize, because some people will say I eat only 2 times. So I cannot force them to eat 6 times a day.
Okay,
So
yes.
I customize to each different to different patients.
Yes. We have one more question, and that is also related to this constipation only. So I think we have covered up that. Yes, so eat high fiber diet and more fruits and vegetables that we can say for that.
And
Uh,
also, thyroid function should be done for each patient with constipation. Sometimes constipation could be due to thyroid dysfunction. So hypothyroidism is very, very common. So thyroid function can be done for that patient.
okay. Like, should they take, is it reversible thyroid function?
Yeah,
Uh,
yeah, yeah, yeah. Why not? We will reverse it. Yeah.
okay. So
We
who?
can, but it is not curable. Reversible means we will reverse it with with drugs. Not, it is not curable. Cure can happen. In let's say subacute thyroiditis, if it is there, so
Mhm,
sometimes thyroid recovers. But once the patient develops hypothyroidism, chronic hypothyroidism due to autoimmune destruction of the glands, then the
mhm.
reversal is less likely.
Okay. See, suppose I am taking my medication for hypothyroidism since last almost 6 to 7 years now. It has come to a very like say below normal condition. This thing, but I am taking like every day still 50 microgram of this thyroid tablet. So, like, is it possible at any point of my life that I will not be needing any medication for that, or I'll have
No,
to take
no.
it for lifelong?
You have to take it for life, ma'am, because the chances of complete recovery of thyroid gland is less likely, because the some destruction has been there, and that will never recover. So thyroid has been partially destroyed. So it could be due to autoimmune etiology, or could be due to thyroiditis, or any other condition, infection. So a lot of conditions could affect thyroid, and your because it has been almost 6 years, so the chances of recovery is very less likely. But one thing you can do is you can lose weight if you are overweight or obese, so that the chance of giving you less dose of medicine is always there. So we have seen patients that after losing weight, the dose requirement of thyroid medicine has gone down.
Mm-hmm. True, true. So basically, like you should never skip your medicines. In fact, that's what
Yeah,
you.
yeah, thyroid medicine, you cannot skip even a single dose. So I always tell my patient that you take your medicine regularly and wait for 1 hour after taking that medicine. And you should never skip a dose. So even if you skip one dose, next day you should take double dose. And if you skip for 2 days, take 3 times on the third day. So like this, even if you miss for 7 days, on the eighth day you take 8 tablets. So like
Eight
this, you should,
tablets.
yeah. So you should take like this, and you should wait for at least 1 hour after taking the thyroid medication. So it is such a pure form of therapy. It is the purest form of therapy that you cannot miss, and you cannot take anything after taking that thyroid medicine. Not even जो gas की गोली, pantoprazole or rabiprazole or any other medication. After taking thyroid medicine, you have to wait for 1 hour.
Okay, but wouldn't it cause side effects if we take like 8 tablets of thyroid medicine on the 8th day? Wouldn't it cause any other side effect?
No, no, it will not cause, because it is a requirement for your body, no? So it will not cause, because and most of the patient will take they will miss 2 doses, so they can compensate for that on the second day or third day. It is
Hmm.
just for explaining them that you should not miss even a single dose. So 365 days, 365 tablets should go in. So most of them will take regularly only. So they will miss one or two doses, and that leads to fluctuation in the TSH levels. So sometimes the patient will have high TSH but normal T4. That means they have missed out on their dose. Maybe हमने तो सर एक ही गोली मिस किया है, दो ही गोली मिस किया है. But sometimes that reflects on your TSH levels.
Same is the case with diabetic medicines, or
No,
that we
no,
can.
no, 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 no. Diabetes medicine is different. So if you miss one dose, you should not take double dose the next day. Otherwise, the
I
risk
know
of
exactly.
otherwise the risk of hypoglycemia will be very high. So
Yes.
if you miss one dose, forget that dose and take the routine dose as advised. So, but diabetes medicine should also be taken regularly, and glucose medicine should be taken, and glucose monitoring should be done on a regular basis as advised by the doctor. So sometimes we advise on alternate days or twice a week or weekly or once in 15 days. So that is the pattern we follow. So third, diabetes medicine is different. So we have to take it regularly without fail. And if you miss out on that, don't take the double dose.
आई एग्री। शुरुआत में तो ऐसा होता है कि जब तक 400 500 तक शुगर पहुंच नहीं जाता, लोग कुछ करते ही नहीं है उसका,
नो
पता भी नहीं चलता।
डायबिटीज इज नेग्लेक्टेड बीमारी है. लोग सोचते हैं कि ठीक है ना, डायबिटीज है, कोई बात नहीं. बट द कॉम्प्लिकेशंस के लिए बहुत पेमेंट करना पड़ता है. तो the treating diabetes is very easy, but treating complications are very difficult. So I will suggest, my motto is to control diabetes, or maybe cure diabetes,
हुँ।
so that the patient doesn't develop complications. One patient came yesterday with 500 plus sugar, and he was taking only one small dose of oral hypoglycemic agent. So we started him on insulin, and after 2 days, and today the glucose has normalized 150 milligram per deciliter. So after a few days, we are going to stop the insulin, and we'll continue him on oral hypoglycemic agents only. So let's see. So treatment is very easy. Only thing is that patient has to come regularly for checkup, and they should monitor the glucose at home itself. And the glucometer is very easily available at a very affordable price.
यस, लाइक वन ऑफ आवर फैमिली फ्रेंड, उनको ही डायबिटीज था थोड़े टाइम पहले। एट दैट टाइम उनका शुगर वाज HbA1c वाज 12 पॉइंट समथिंग। थोड़े टाइम मेडिसिन लिया एंड देन दे स्टॉप्ड ऑन देयर ओन। अभी शी वाज टेलिंग मी दैट शी इज नॉट टेकिंग एनी मेडिसिन एट ऑल, एंड उन्होंने अपने आप ही से कंट्रोल करके, ये करके, एक्सरसाइज करके सब खुद ही रिवर्स कर लिया। नाउ शी इज नॉट टेकिंग एनी मेडिसिन, बट ये करना भी कितनी हद तक सही है?
No, that can be done, madam. This HbA1c is 12.5. The glucose must have been between 300 to 400 milligram per deciliter. So if you do intense exercise, let's say I've already told that if some patient does intense exercise for 1 to 2 hours a day and they lose weight, let's say 5 to 10% of the initial baseline body weight, the
Yeah,
diabetes
she
is
lost
reversible.
almost 10 to 15 kgs of her weight.
That is why her diabetes has gone down, or have been reversed. So, what is her recent HbA1c?
That is something 5.9 something.
So that is because of the intense exercise and weight loss.
Hmm.
So but that should be maintained for some time, for long. Otherwise, what will happen is again she will develop glucose intolerance and recurrence of diabetes. So ask her to continue this intense exercise for as long as possible, maybe till the end of the life.
ओके, शुरुआत में अदरवाइज ऐसा होता है कि लोग खुद ही अपने आप ही कंट्रोल करने का ट्राई करते रहते हैं उसको, कि भाई हाँ मैं कर लूंगा करके मेडिसिन लेना, डिले करते जाते हैं, डिले करते जाते हैं। बट ये भी
No, no, no. Problem is that people को डायबिटीज की एजुकेशन नहीं है. तो दे शुड गेट डायबिटीज एजुकेशन. दैट इज मोर इम्पोर्टेंट rather than treating or becoming a doctor on their own, because diabetes is a meetha bimari. It's a slow poison. It will kill you bit by bit.
Hmm.
So I think that they should consult a doctor. Definitely, they can go for exercise. It is well known. Everybody knows the benefit of exercise. They should go for exercise 30 to 60 minutes at least on most of the days. Most of the days means 7 days a week. Or if they are not able to go for exercise 7 days a week, at least 5 days a week they must go. एंड ईट इन मॉडरेशन. एक्सरसाइज कर लिया और लड्डू खा लिया, फिर पकौड़े खा लिए, पिज़्ज़ा आ गया तो वो भी एक पीस ले लिया, तो दैट शुड नॉट हैपन. सो दे शुड ईट इन मॉडरेशन. आई डोंट से दैट डोंट ईट पिज़्ज़ा, बट लेट्स से मे बी वंस इन अ वाइल, वीक में एक बार या 15 दिन में एक बार, उस तरीके से. मिठाई खाना है, एक छोटा पीस खा सकते हैं, बट बिफोर दैट योर शुगर शुड बी अंडर कंट्रोल. So our target is less than 140 in fasting or pre-meal state, and less than 180 in post-meal state. Post-meal is 1 to 2 hour after a meal. So that should be there. If the targets they are meeting, then they can eat sweets also in moderation. But they should not become doctor on their own, because every day diabetes is killing you. Uh, Whenever there is rise in glucose, it is hitting your kidneys, heart, brain, eyes, everywhere it is hitting, and it is producing some damage. Micro damage is happening every day, every minute.
I know, I know. According to a health survey, like in by 2030, we should be among the first जिनमें
Yeah, yeah.
डायबिटीज सबसे
We
ज्यादा
will
होगा.
become the number one compared to China. Yeah.
हाँ, कई बार वी आर नोटिसिंग कि पीपल जो दवाई लेते हैं, दे आर सेइंग हाँ मैं तो दवाई भी ले रहा हूँ, मेरा तो डायबिटीज भी HbA1c भी कंट्रोल में आ रहा है. मैं रैंडम ब्लड शुगर टेस्ट कराता हूँ तो वो भी कंट्रोल में नॉर्मली आता है बिलो 120, तो आई कैन ईट एवरीथिंग. बट पता नहीं है वो भी किस हद तक करना चाहिए या वेयर शुड बी कंट्रोल.
No, no, नहीं करना चाहिए, because 120 आ रहा है, that doesn't mean that you will be relaxed and you will do anything whatever you want. So they can eat in moderation. Moderation means चलो समोसा खाना है, ठीक है, एक समोसा खा सकते हैं, मीडियम साइज समोसा. जलेबी खानी है, एक जलेबी या दो जलेबी खा सकते हैं. लड्डू खाना है, एक से दो लड्डू खा सकते हैं. If your glucose is under control, you can take things in moderation. ग्लूकोज कंट्रोल में है तो इसका मतलब ये नहीं है कि यू कैन डू पार्टीज एंड यू कैन ईट एनीथिंग एंड एवरीथिंग. The moment people go to party, they will eat laddus. Laddus is not that halwas is available. Halwas and
वाह,
other this क्या है वो, ice
these
cream
dairy products.
and some sweet is available. Jalebis are also available. So this they will eat, try all in, especially in Kolkata. If you go to Kolkata, you will get some at least 1 dozen type of mithais, because Kolkata is famous for mithais. So when you go to some hotels and all, you'll get at least 1 dozen type of mithai, Kolkata rasgulla and cham cham and whatnot. So they will try all the mithai. So that should not happen. They can eat and they should have control over their mind. भूख तो एक खोपड़ी में है, पेट में नहीं है. तो that mind control is, mindfulness should be there.
एग्जैक्टली, यस, वेरी ट्रू, वेरी ट्रू. क्योंकि अगर जिसका स्वीट टूथ होता है ना, दे कैन नॉट कंट्रोल, कुछ
नो
भी
नो
कर लो.
मैडम, उसमें उसमें प्रॉब्लम क्या होती है ना, कि उनको खाना नहीं आता है. वो खाते हैं बस, पहले सबसे पहले तो रोटी खाएंगे, चावल खाएंगे, और फिर वो ढूंढेंगे मिठाई का काउंटर कहाँ है. आई थिंक दे शुड, व्हेनेवर दे गो फॉर शादी पार्टी में या कहीं पे भी जाते हैं, तो उनको छोटा प्लेट यूज करना चाहिए. दैट इज वन. And second thing is, they should eat very slow. Even in parties they should talk more, they should meet more people, and they should eat slowly. तो जो जैसा कि मैं बताता हूँ पेशेंट्स को कि भाई थोड़ा फ्रूट खा लो, थोड़ा छाछ या दही खा लो, आखिरी में रोटी सब्जी खाओ. तो दैट ट्रिक्स वर्क्स वेरी वेल. एंड सेकंड थिंग इज दैट कैन व्हाट दे कैन डू इज दे कैन ईट एट होम. आधा खाना तो घर से खा के जाना चाहिए. तो उससे क्या होता है, तो उससे जब when the moment they reach venue, the almost 80% of the appetite is gone. तो उसमें फिर जा कर के थोड़ा बहुत खाएंगे, वो उनका मन ही नहीं करेगा, because the appetite is lost. So we need some at least 15-20 minutes to for our brain to sense that okay, we have eaten enough. तो कई बार ऐसा होता है कि खाना भूख लग रही होती है तो जल्दी जल्दी में ज़्यादा खा लिया, फिर बाद में ऐसा ज़्यादा फुलनेस आता है कि पीपल फील अनईजी. और कई बार ऐसा होता है कम खाया बिकॉज ऑफ स्कैरसिटी ऑफ टाइम, लेकिन थोड़ी देर के बाद फुलनेस आ जाती है कि हाँ ठीक है, सफिशिएंट है। तो
Hmm.
कम खाने के फायदे बहुत हैं, ज़्यादा खाने के नुकसान बहुत हैं।
Exactly. Very well said, doctor. So yes, now we are coming towards the end of our show. We all have like many challenges, but we got to make sure that we be conscious of what we are eating and drinking, because we first make our habits, then our habits make us. So let's work together in building wellness rather than treating illnesses. So nurturing yourself is like not a selfish act, but it's essential for your survival and well-being. So if you are facing any of the above challenges in your life, then you can book a free discovery call with any of us, or you can drop a message on my social media handle as well. And yes, the key points are: eat healthy, move more, practice yoga, meditation, increase your mindfulness, take your medications regularly, and always look on the positive aspects of life. So stay healthy and stay fit.
Very well said, ma'am. Thank you so much for the opportunity, and
Thank you.
do connect with me for any kind of problem, not only hormones, any kind of medical illness. You can connect with me. Thank you so much for the invitation.
Yes, yes. Thank you so much, Dr. Agarwal, for coming on our show and giving us so much insightful knowledge and information to all our audience and everyone. And yes, I will share a visiting card of Dr. Agarwal as well. And you can take a screenshot of that in case if you need any time, any help. So he is having his own private clinic, Arya Endocrine Diabetes and Hematology Center on Science City Road in Ahmedabad. He is also working as a consultant at Epic Super Specialty Hospital. So you can connect with him over there as well. The numbers and everything has been provided on the card. You can take a screenshot.
It's not coming on the screen, ma'am. You are able to see?
Is it?
Yeah. Now it is coming. Yeah.
Okay. Yes, he is having his clinic on Science City Road. Is somebody trying to say something? I cannot hear. Can you please type the question? I cannot hear you properly. Your voice is cracking. So if you can type the question, it will be good for us because we are not able to hear you properly. Okay. So yes, thank you so much, doctor, for your time. And yes, we would definitely like to connect with you on different such occasion. And thank you so much again.
Thank you, ma'am. Thank you so much for
Thank
the
you, thank you,
invitation.
thank you.
Thank you
And
again.
wishing you all the best.
Thank
Thank
you.
you.
Thank you.
Bye bye. Thank you.
Bye.